Have you ever noticed that one of your joints feels unusually warm to the touch? Maybe it is accompanied by a bit of tenderness or swelling. It is a common sensation, but if you have osteoarthritis, it is definitely something worth understanding. For those living with osteoarthritis, joint warmth often means that there is increased inflammation within the joint. This can be a sign of an osteoarthritis flare-up or that your joint is under more stress than usual. It is your body's way of telling you to pay attention. Now, why does this happen? Osteoarthritis is primarily a condition of cartilage breakdown, but it also involves inflammation of the joint lining, called the synovium. When the protective cartilage on the ends of your bones wears down, it can release tiny microscopic particles into the joint fluid. Your body's immune system, sensing these foreign particles or cellular debris, reacts by initiating an inflammatory response. This inflammation increases blood flow to the affected area, which is precisely what makes the joint feel noticeably warm to the touch. Think of it like your body sending in the cavalry to an area it perceives as being under attack or needing repair. This heightened inflammatory activity can be triggered by several factors. Sometimes, it is simply due to overuse of the joint, such as after a long walk or intense activity. Other times, changes in weather, a minor injury, or even just the natural progression of your osteoarthritis condition can bring on this inflammatory response. It is also very important to remember that sometimes, though less common with typical osteoarthritis flares, persistent warmth could indicate an infection within the joint. That is why observing other symptoms like significant redness, intense pain, or fever is crucial, and it means you should definitely reach out to your doctor right away. So, what can you do when your joint feels warm? The first and most immediate step is to give that joint some well-deserved rest. Avoid activities that might have aggravated it, allowing your body time to calm down. Applying ice packs can be incredibly effective in reducing both the warmth and any associated swelling. Aim for 15 to 20 minutes at a time, several times a day. You can also gently elevate the affected joint if possible, which helps reduce fluid accumulation and eases discomfort. Over-the-counter anti-inflammatory medications, like ibuprofen or naproxen, can also help manage the pain and inflammation, but always check with your doctor or pharmacist first to ensure they are safe for you and do not interact with any other medications you might be taking. If the warmth persists for more than a few days, is accompanied by significant new or worsening pain, redness, or fever, or if you ever suspect an infection, it is absolutely time to contact your doctor promptly for guidance. This specific inflammatory process, where the joint lining gets irritated and swollen, is medically known as synovitis. While it is a natural part of your body's complex response to joint changes, chronic or frequent synovitis can unfortunately contribute to further cartilage damage over time. Recognizing joint warmth as a clear sign of this underlying inflammatory activity allows you to intervene early, potentially protecting your joint structure and significantly reducing your discomfort. It also helps you distinguish between what we call mechanical pain, which might simply be discomfort from movement or overuse without significant inflammation, and inflammatory pain, which suggests a more active and potentially damaging process within the joint. Knowing this difference is a real advantage in managing your condition effectively. Ultimately, understanding that joint warmth signals an active inflammatory process is a truly powerful tool in managing your osteoarthritis proactively. By recognizing this important sign, you can take informed steps to reduce that inflammation, alleviate your discomfort, and potentially even slow down further joint damage. This kind of awareness empowers you to respond effectively to your body's signals, work even more closely and collaboratively with your healthcare team, and ultimately maintain a better quality of life with your osteoarthritis. Always remember, you are an active partner in your health journey.